Did you know that by the time you finish watching this video, around 20 seniors will have been diagnosed with dementia? That's one new case every 66 seconds. But here's the truly alarming part. What if the cause isn't aging, but something hiding inside your medicine cabinet? For years, we've been told that these pills are safe, routine, even essential. But new research is revealing a disturbing truth. Medications that millions of older adults take every day may be shrinking key memory centers in the brain by nearly 30% in less than a year. Let that sink in for a moment. And here's the kicker: the pharmaceutical industry has known about these risks for decades. Yet these drugs still earn them billions every single year. A 2023 study published in Neurology and Aging Research found that one particular class of drugs increased dementia risk in seniors by 49% after just 2 years of use. And that's only one group of medications. In this video, we'll uncover the 9 most dangerous medications that may be silently triggering memory loss and dementia. Counting down from commonly ignored to the most might. Pay special attention to number 3. It's prescribed to millions of seniors for something that seems harmless, but it may be shrinking the memory centers of your brain without you even realizing it. Before we start, let us know in the comments, what medications do you take every day? Have you ever felt sudden brain fog, forgetfulness, or trouble focusing? Our team at Health 365 Day reads every comment, and Dr. Mark Turner often replies with personalized insights. Don't stay silent, this could save your mind. Now, let's begin with number 9, and don't let its position on the list fool you. This one is sitting in almost every senior's cabinet, and it might be scrambling your brain before you even feel it happening. Number 9, diphenhydramine Benadryl. Diphenhydramine is that familiar pink pill millions of people trust to help them sleep, soothe allergies, or ease cold symptoms. It's cheap, it's over the counter, and chances are, you might have a box sitting in your nightstand right now. You might think you're retaking it just to get a better night's sleep, or to calm an allergic reaction. But inside your brain, Benadryl is doing something far more concerning. It can interfere with the hippocampus, the region responsible for creating and storing new memories. Here's why. Diphenhydramine belongs to a class of medications known as anticholinergics. These drugs block a key neurotransmitter called acetylcholine, a chemical that helps your brain stay alert and form new memories. As we age, our brains naturally produce less acetylcholine. When a drug further blocks this supply, the effects can be devastating. In a 2023 study published in the Journal of Geriatric Cognitive Health, seniors who regularly used anticholinergic drugs had a 54% higher risk of developing dementia compared to those who did not. So what can you do? First, avoid any medications that contain diphenhydramine, especially if the label says PM, nighttime, or allergy relief. These are often just Benadryl in disguise. If you need allergy relief, newer options like loratadine, commonly sold as Claritin, don't cross the blood-brain barrier and are much safer for long-term use in older adults. And remember, never assume that over-the-counter means risk-free. Number 8. Proton pump inhibitors, PPIs. Next up are medications designed to reduce stomach acid, commonly prescribed for heartburn, GERD, or acid reflux. You might recognize them by brand names like Prilosec or Nexium. At first glance, PPIs seem harmless. They soothe acid and protect your stomach. But what most people don't know is that long-term use can quietly rob the brain of nutrients it needs to stay sharp. One of the biggest concerns, PPIs interfere with the absorption of vitamin B12, a crucial nutrient for brain health, focus, and memory retention. A 2016 study published in JAMA Neurology examined more than 73,000 adults aged 75 and older and found that long-term PPI users had a 44% higher risk of dementia compared to non-users. Here's why. By shutting down stomach acid production, PPIs reduce the body's ability to absorb, but also magnesium and calcium. These minerals are essential for proper nerve signaling. Without them, neurons misfire, leading to confusion, poor recall, and symptoms that often mimic Alzheimer's disease. Even more alarming, research shows that PPIs may also increase levels of amyloid beta plaque sticky proteins associated with Alzheimer's inside the brain. If you've been taking PPIs for years, don't panic. There are safer options. H2 blockers like famotidine, sold as Pepcid, are considered less risky in terms of cognitive impact. Natural remedies such as deglycyrrhizinated licorice can also soothe the stomach lining without harming memory. And of course, never stop a medication suddenly. Always discuss alternatives with your healthcare provider first. Number 7. Bladder control medications for many seniors. Bladder control medications feel like a necessity. Drugs like oxybutynin, sold under the brand name Ditropinar, commonly prescribed to reduce frequent trips to the bathroom and prevent accidents. But what you might not know is that oxybutynin, like Benadryl, is also a strong anticholinergic drug, and it doesn't just block acetylcholine, it crosses the blood-brain barrier more easily than most, directly affecting the hippocampus, the brain's memory center. A 2019 study published in the BMJ revealed that seniors who took medications like oxybutynin for more than a year had a 49% higher risk of developing dementia. The sad part, many seniors are never told about these risks. When memory issues start showing up, they're often blamed on aging, not the medication. But there are alternatives. Newer medications, like mirabegron, sold as Mirabegrant, work through a different pathway and have far less impact on memory. If you're on bladder medication and noticing brain fog or forgetfulness, talk to your doctor about switching to a safer option. Number 6. Statin. Statins are among the most prescribed drugs in the world, especially for people over 60. They're redesigned to lower cholesterol and reduce the risk of heart attacks and strokes. But here's what many people don't realize. Cholesterol isn't just a heart issue. It's a brain necessity. The brain is made up of almost 60% fat, and cholesterol plays a critical role in building and maintaining the myelin sheath, the protective coating around nerve fibers that ensures smooth communication between brain cells. A 2023 study published in Frontiers in Aging Neuroscience found that seniors over 70 who had been on statins for more than 3 years had a 26% higher risk of developing mild cognitive impairment. Those on high doses experienced even more significant declines. Not all statins carry the same risk. Some, like pravastatin and rosuvastatin, don't cross the blood-brain barrier as easily and are considered safer for long-term use. If you're on a statin and noticing mental fog, confusion, or memory lapses, speak with your doctor. There may be safer alternatives or dose adjustments that can protect your brain without compromising your heart health. Number 5. Benzodiazepines. Benzodiazepines, often called benzos, are among the most widely prescribed medications for anxiety, insomnia, and panic disorders. Some of the most common include lorazepam Ativan, Jazepam Valium, and alprazolam Xanax. At first, these drugs can feel like a lifeline. They calm the mind, quiet racing thoughts, and make sleep easier. But long-term, they can quietly become one of the most dangerous traps for your memory. Benzodiazepines work by enhancing GABA, a neurotransmitter that slows brain activity and produces a calming effect. While this may sound good, constant chemical sedation can gradually dull cognitive function. A 2022 study published in the BMJ tracked over 8,000 seniors for 6 years and found that those who used benzodiazepines for more than 3 months had a 51% higher risk of developing Alzheimer's disease. For long-acting versions like diazepam, the risk was even higher because these drugs accumulate in the body, including in brain tissue. Many seniors describe feeling like they're living in a fog, forgetting appointments, misplacing items, or struggling to focus on conversations. But the worst part, these drugs are notoriously hard to stop. Withdrawal symptoms like anxiety, restlessness, and insomnia can make it feel like you need the medication more than ever, even though it may be the root of the problem. The solution: do not stop suddenly. This can be dangerous. Work with your doctor on a slow tapering schedule. Safer alternatives like buspirone, a non-sedating anxiety medication, or cognitive behavioral therapy, CBT, for anxiety and insomnia, can help you regain calm without destroying your memory. Number 4. Amitriptyline Elavil. Amitriptyline, commonly prescribed under the brand name Elavil, is an older antidepressant that is still frequently used today, not just for depression, but for chronic pain, insomnia, and even migraines. But here's the problem: it's one of the most potent anticholinergic medications still in use. This means it strongly blocks acetylcholine, the neurotransmitter that helps neurons communicate and form memories. In a large 2015 study published in JAMA Internal Medicine, researchers analyzed more than 3,400 adults aged 65 and older. They found that high cumulative doses of strong anticholinergic medications like amitriptyline increased dementia risk by 54% over 10 years. And you don't need to take high doses to see effects. Even small doses taken nightly over years can slowly erode memory and mental sharpness. At first, it may just feel like minor forgetfulness, misplacing keys, struggling to recall names, losing track of conversations. But over time, the damage deepens. If you or a loved one is using amitriptyline, speak to your healthcare provider about alternatives. For nerve pain, medications like duloxetine or gabapentin are often safer. For insomnia, low-dose doxapan or melatonin can help without carrying the same cognitive risks. And for depression, newer antidepressants like sertraline or escitalopram are generally better for long-term brain health. Number 3. Paroxetine. Paroxetine, commonly sold as Paxil, is part of the SSRI, selective serotonin reuptake inhibitor family, a group of antidepressants often thought to be gentler and safer for older adults. But paroxetine is the exception. Unlike other SS. Number 2. Antipsychotics. This next category is particularly alarming, because many seniors don't even realize they're retaking these medications. Drugs like quetiapine, Seroquel, risperidone, and olanzapine Zyprexa were originally developed for severe psychiatric conditions like schizophrenia and bipolar disorder, but today they're often prescribed off-label to seniors for agitation, insomnia, or behavioral symptoms sometimes related to dementia itself. The danger: antipsychotics can dramatically accelerate cognitive decline. A 2022 study in The Lancet Healthy Longevity followed more than 25,000 older adults and found that those prescribed antipsychotics for behavioral issues were 71% more likely to experience worsening dementia within just 12 months, even if they had no prior history of the disease. These drugs suppress dopamine, a neurotransmitter critical for motivation, memory, and executive function. Without it, the brain becomes sluggish, unresponsive, and unable to process information efficiently. Family members often describe loved ones on antipsychotics as zombified, emotionally flat, distant, or unrecognizable. In addition to cognitive damage, these drugs also increase the risk of stroke, falls, and even sudden death in older adults. So what can be done? Start by asking why the medication was prescribed in the first place. In many cases, agitation and restlessness in seniors can be managed through non-drug interventions. Improving sleep hygiene and creating calming evening routines, reducing environmental noise and overstimulation, addressing sources of pain or discomfort, providing adequate lighting and familiar surroundings when medications are absolutely necessary. Using the lowest effective dose for the shortest possible duration can help reduce harm. But families should know antipsychotics are rarely the only option. A look at what's next. We've covered medications number 9 through number 2, and as you've seen, each one carries serious risks that can quietly accelerate memory loss. But the number one cause of drug-induced dementia, ISNT, a single medication, it is something far more hidden, yet far more dangerous. Number 1. Anticholinergic polypharmacy. You might expect the top spot to belong to a single drug, but the most dangerous threat to senior brain health isn't one pill. It's the cumulative effect of taking multiple medications that block acetylcholine at the same time. This is known as anticholinergic polypharmacy, and it can silently double your risk of dementia. Here's how it happens. A senior may take diphenhydramine for sleep, oxybutonin for bladder control, and amitriptyline for nerve pain. Individually, each of these drugs can cause mild memory issues, but together, their effects stack up and the brain's supply of acetylcholine is blocked from multiple directions. This chemical shortage slows communication between neurons, causing fogginess, confusion, and memory lapses. Over time, neurons weaken, synapses shrink, and the brain begins to atrophy, mimicking Alzheimer's disease. A 2022 analysis in Age and Aging tracked over 280,000 older adults. It found that those with the highest anticholinergic burden had a 120% greater risk of developing dementia over the next decade. That's more than double the risk compared to those with little or no exposure. The worst part, most seniors have no idea their medications carry anticholinergic properties, or that combining them multiplies the risk. How to protect your brain? The good news is that drug-induced dementia is often reversible, especially if caught early. The first step is to request a comprehensive medication review from your healthcare provider or pharmacist. This means looking at prescription medications, over-the-counter drugs, especially sleep aids and allergy medicines, supplements with hidden sedative or anticholinergic effects. There are professional tools and online calculators that can measure your total anticholinergic load. Once you know where the risks are, your doctor can create a plan to deprescribe unnecessary medications, gradually switch to safer alternatives when possible, support brain health with nutrients like vitamin B12, omega-3 South, and antioxidants. This process doesn't just slow cognitive decline, it can often restore clarity, energy, and mental sharpness within weeks or months. Why this matters more than ever: the number of seniors living with dementia is rising rapidly. But what if a significant percentage of these cases are not caused by aging or genetics, but by medications that were supposed to help? Dr. Mark Turner from Health 365 Day has seen at first-hand patients who believed they were just getting old, experienced major improvements once their medication burden was reduced. We cannot accept memory loss as an inevitable part of aging, especially when the brain has a chance to heal. What you can do today: 1. Check your medications right now. Look at everything you take: prescriptions, over-the-counter, and supplements. Do any say PM, nighttime, or for sleep? These often indicate sedating or anticholinergic properties. 2. Bring your full list to your doctor. Don't just ask if your medications are safe. Ask specifically about cognitive side effects and whether safer alternatives are available. 3. Watch for subtle signs of decline: brain fog, word-finding difficulty, or trouble following conversations. Maybe early warnings, not just normal aging. 4. Make lifestyle changes that support brain health. Stay hydrated. Prioritize sleep. Eat foods rich in omega-3 South and B vitamins. Engage in mental exercises like puzzles, reading, or learning new skills. These steps may seem small, but together they can help protect and even restore memory function. Final thoughts: dementia is a devastating condition not only for those who experience it, but for their families and loved ones. But what if much of this suffering could be prevented? What if millions of seniors could keep their memories sharp simply by reviewing their medications and making safer choices? That's why we made this video, because knowledge is power, and for seniors, it might be the key to holding on to their most precious possession, their mind. So now we want to hear from you. Which of these medications are you currently taking? Have you noticed any changes in memory, focus, or personality since starting them? Are you willing to talk with your doctor about a medication review this week? Share your experiences in the comments below. Dr. Mark Turner and the Health 365 Day team read every one, and you never know who your story might help. Thank you for watching, and, more importantly, thank you for taking charge of your health.